Assalamualaikum warahmatullahi wabarakatuh to our Dr. Abdul Rahman. In this video, I will going to present a case study that is focused on healthcare industry. Our topic is optimizing information flow and knowledge management practices at Klinik Kesihatan Malaysia. First, let's get to know our team members.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm Zarifatun Nadira 2410262, and now I'm going to present to you the introduction part of this project where Malaysia's government clinics like Klinik Kesihatan Malaysia face issues with poor knowledge management and information sharing lead to delays, errors and unsatisfactory patient care. Many workers don't share their expertise, causing knowledge gaps and less effective treatment. Unprofessional behavior and lack of proper training also add to the problem. So, improving knowledge sharing, creating better training programs, and encouraging collaboration can solve this issue. A strong knowledge management system will lead to better care for patients and smoother clinic operations.
My name is Rubaiyah Bhuya. So in this slide, I will explain the methodology we use to conduct our research. Our approach is divided into 5 key components to ensure a well-rounded analysis. First, we begin with the literature review by analyzing existing research, government report, and HOW publication. These allow us to focus on operational challenges to identify innovation practices in healthcare. Second, we conducted quantitative interviews with 25 stakeholders, including healthcare provider, patient, and policymaker. These interviews explore topics such as source constraint, health literacy issue, and strategy to improve service delivery. Third, we use quantitative surveys to collect data from 5,000 patients across 10 clinic Kesihatan faculties. This service helps us ensure waiting time, survey quality, accessibility, and patient satisfaction. Fourth, we perform comparative case study by examining healthcare model in Thailand, Singapore, and Indonesia. This helps us identify effective status like universal healthcare, digital integration, and the use of mobile clinic. Lastly, we conducted a policy analysis to evaluate Malaysian healthcare policy. We compared them with the best international practices to highlight areas where improvement can be made. Together, these 5 methods provide us with a valuable insight and the sole foundation of our findings.
Hi, my name is Nur Arshaba Rashid. My metro number is 2413882. Now I'm going to talk about analysis of current information flow at Klinik Kesihatan Malaysia. Firstly, they use formal communication methods. Electronic health records, also known as EHRS, serve as the backbone of formal communication in the clinic, strictly storing patient data such as medical history, diagnosis, treatments, and lab results. These systems integrate seamlessly with external tools like laboratory systems and pharmacies. It will reduce manual processes and enabling quick information storage. Second, they use official memos and reports. These are essential for administrative communication, providing a structural way to share updates such as policies, changes, SOPs, and official instructions, delivered via email, printed notices, or oral platforms. Memos and reports help ensure accountability, regulatory compliance, and consistency in decision making. Next, they also use patient management systems. These systems are vital for improving operational efficiency and patient experience. Features such as appointment scheduling, referral tracking, and queue management optimize patient flow and reduce wait time. Second, they also use informal communication methods. First, they use verbal communication. Verbal communication plays a crucial role in real-life time decision making during emergency and for coordinating daily operations. It is especially effective during patient routes, team huddles, or managing tasks in busy clinic system. However, this method often lacks documentation and carries a risk of misunderstanding, which can affect follow-up actions and clarity. Lastly, KK1M also use WhatsApp groups and messaging apps. Messaging apps like WhatsApp are widely used for quick updates, reminders, and informal team communication due to their ease of use and instant connectivity. However, their lack of robust security features poses privacy risks, particularly for sensitive patient information. Despite their convenience, these apps do not meet formal communication standards, which may lead to compliance and challenges. Next, I'm going to talk about knowledge management practices at Klinik Kesihatan Malaysia. First, knowledge creation and storage. Klinik Kesihatan Malaysia employs both digital EHRs and physical records to manage patient data and healthcare knowledge. These systems include vital resources such as clinical guidelines, policy manuals, and case studies that support day-to-day operations and decision-making. However, maintaining dual systems often results in duplication and error, which can hinder workflows efficiency and consistency. To address this issue, the clinic is actively working on developing a centralized system that integrates all data into one streamlined platform. Second is collaboration tools. Communication and coordination among teams in KKYN primarily rely on platforms like WhatsApp and email. These tools are convenient for quick updates and basic communication. However, they lack the structure required for efficient sharing of information and real-time collaboration. This limitation is further used by the absence of a dedicated healthcare intranet, which could facilitate seamless exchange of best practices and resources. To mitigate these gaps, regular meetings and committee discussions are held to align patient care strategies and administrative decisions. Lastly is decision making. The decision making process in KKYM heavily depends on accessible knowledge repositories such as EHRS for developing treatment plans, managing referrals, and making operational decisions. However, the fragmented nature of the current systems often delays access to critical data, which can slow down decision-making in time-sensitive scenarios. Additionally, the absence of a dedicated system support system forces staff to rely primarily on manual expertise and individual judgment.
My name is Nurmansara binti Nur Azasha and my metric number is 2410666. Today, I will discuss the challenges faced by Klinik Kesihatan 1 Malaysia and how effective knowledge management can improve the quality of healthcare service provided. Despite its mission to deliver accessible healthcare to Malaysians, KK1M encounters several persistent issues that hinder its performance and reduce patient satisfaction. The first issue is the challenges in nurse-patient interactions. Many patients have reported negative experiences with nursing staff, including rudeness and impatience. These behaviors often create a hostile and unprofessional environment, making it difficult for patients to feel comfortable and supported. This issue arises from several factors, such as high levels of stress among staff, heavy workloads, and a lack of proper training, ineffective communication. Furthermore, weaknesses in knowledge sharing practices means that the best practices for interacting with patients are not consistently shared or implemented. Addressing these gaps is crucial for fostering better emotional connections between nurses and patients, building trust, and improving overall patient satisfaction. The second point is inconsistent clinic hours. Many patients have found that clinics are either closed or understaffed despite the posted hours. This inconsistency frustrates patients and makes the clinic seem unreliable. Patients, especially those with busy schedules, end up stranded, while overcrowding during uncertain hours leads to longer waiting times. This issue stems from poor communication and outdated information. By improving scheduling and keeping patients informed, the clinic can rebuild trust and reliability. And lastly, inefficient patient flow. Long waiting times are caused by disorganized patient flow. Without standardized processes for things like registration, consultations, and treatments, there are bottlenecks that delay care. Peak hours make the situations worse, and patients often don't know what to expect next, which will increasing confusion. Clear communication and better resource management can reduce delays and improve the overall experience. Next, I'm going to talk about proposed solutions and recommendations for Klinik Kesihatan Malaysia. So the first one is addressing poor attitudes and unprofessional behavior among nurses. Provide training on communication, empathy, and emotional intelligence, along with counseling and flexible scheduling to manage stress. Clear behavioral guidelines and recognition of exemplary conduct can promote professionalism. The second one is resolving inconsistent clinic operating hours. Strictly enforce schedules with accountability measures, notify patients of changes via digital platforms, and use automated tools to ensure consistent staff coverage. The third point is tackling long waiting times. Implement digital queue systems for real-time updates, use triage to prioritize urgent cases, and address peak hour demands with additional staffing and appointment-based systems. And then the fourth point is enhancing knowledge management and communication. Develop a centralized platform for SOPs and updates, train staff on effective information sharing, and use secure messaging apps for instant communication. So, by improving staff behavior, consistent hours, and shorter waiting times, it can enhance patient trust, while better workflows boost productivity and strengthen the clinic's reputation as a reliable healthcare provider.
So now we move to the conclusion part, where Malaysia's government healthcare facilities such as Klinik Kesihatan Malaysia face significant challenges like inconsistent operating hours, long waiting times, unprofessional staff behavior, and poor knowledge management. So based on these problems, these issues lead to inefficiencies, patient dissatisfaction, and operational strain. Moreover, to address this problem, key solution include staff training in professionalism and empathy, enforcing consistent operating hours, and using digital platforms for communication and scheduling. Moreover, queue management systems, triage protocols, and centralized knowledge platforms can further streamline operation and improve patient care. Also, regular audits and real-time analytics will sustain these improvements. Lastly, by adopting these strategies, Klinik Kesihatan Malaysia can enhance patient satisfaction, optimize workflows, and set a benchmark for efficient, patient-centered healthcare in Malaysia.
Okay, that's all from us. Thank you for watching.